My name is Amelia. I'm a public health educator at MaineGeneral Medical Center. This presentation will cover basic information on needle gauge and needle length. There are a lot of health risks associated with substance use. In particular, the most health risks are associated with injection drug use. A lot of factors go into injection safety. The health risks associated with injection drug use fall into one of three categories: either drug-related, technique-related, or hygiene-related. Because this presentation will focus on needle gauge and length, this information will be related to technique. People have different preferences on the needle gauge and length when they are injecting drugs. They might have a preference because of experience, type of drug they're injecting, or how their body reacts to the needle size. In order to understand a little more about these preferences, let's start with what needle sizing actually means. So what is needle gauge? Needle gauge is the size of the needle hole. The size of the needle hole will allow more substance to go through faster. Think of a funnel. If it has a wider hole, more liquid can go through it faster and thicker liquid can go through it. It's the same with needles. If the gauge is higher, for example a 31 gauge, the hole will be smaller. So the needle will be thinner. Less liquid or drug goes through the needle at once and you'll be able to use a very thin liquid. Nothing thick or rough like black tar heroin will go through a thin, higher gauge needle. At the Next Step Needle Exchange, we offer 4 needle sizes: 28 gauge, 29 gauge, 30 gauge, and 31 gauge. Because 28 is the lowest gauge we offer, it has the widest needle hole. When you have a higher needle hole, there is less chance of the drug clogging the needle, but there is a higher chance of infection or bleeding because the needle may be too wide and may damage your skin more. People who inject drugs into their muscle or intramuscularly, like into their arm or their thigh, typically use a larger gauge needle. Our thinnest needle gauge, the 31 gauge, is a lot more thin and exact when it enters the skin, so there's less chance of infection and less chance of bleeding. However, some people struggle with using a thin needle because the drug might clog the needle often. We find that people most like the 29 gauge and the 30 gauge, which are more average-sized mid-range needles. The needle length typically comes in a long or a short length. At the Next Step Needle Exchange, like many other needle exchanges, we offer 2 lengths, a long and a short. Our 5/16 inch is the short needles and our 1/2 inches are the long needles. So we have 2 shorts and 2 longs for needle length options. Like the gauge, people typically find a preference for the length of the needle that they like, either shorts or longs. Sometimes it depends on what substance they're using or when they're using in their body. For example, when you inject into the muscle, it's important to use a longer needle, but when people inject into their veins, they find long needles to possibly be too long so that the precision is lost and they may pass through their vein and hit another part of their body. Regardless of what needle length or gauge you're using, it's essential to use new, clean needles every single time you inject. The Next Step Needle Exchange supplies materials like clean cottons, cookers, tins, needles, sterile water packages, alcohol prep pads, and triple antibiotic ointment. These materials help create a safer, cleaner drug use if you choose to use.